George Bakhturidze,
Yes.
welcome to the World Conference on Tobacco Control and to this chat with Ash Scotland. Tell me a little about the work you do.
Thank you so much for your invitation. I'm working in tobacco control during of last 25 years and more maybe. Firstly, I was involved, and first time I remember that I was participated on the World Conference on Tobacco Health in 2000. It was held in Chicago. It was huge conference, and from that time I started work in this issue and in this field. Then I moved to and participated on the negotiations regarding Framework Convention on Tobacco Control. From the beginning as a representative from the government, and afterwards as a representative from non-governmental organizations. Then I also participated on COPs, in all of COPs maybe, and MOPs related to FCTC, and also illicit trade protocol negotiations, and afterwards also MOPs. And with regard of my country, I started work in the National Tobacco Counter Center since 1988, and as a programs manager, and afterwards as an executive director. And afterwards this organization disappeared after a few years because of some limited funding situations and some troubles regarding funding. And in 2003 I founded our organization, FCTC Implementation and Monitoring Center in Georgia, which is a coordinator of Tobacco Control Alliance now. And this alliance counts around 20 different kind of NGOs and professional health related organizations in our country, and we together creating some policy agendas regarding tobacco control and health promotion, but mostly for tobacco control. And now I am like a political advocate for health, but most people knows me from the tobacco control activities in my country. Real advocates for health. We continued our work to achieve our goal to create really smoke-free and tobacco-free environment in my country. And regarding our achievements, first law was adopted in 2003. Then we joined to Framework Convention on Tobacco Control, and we became members, and it's I would say entered into force for Georgia since May of 2006. Then, on the basis of new obligations from FCTC, we changed the law. It's happened in 2008, and but those changes were not effective because of very weak enforcement mechanisms. And then we continued our efforts, and 2013 there was opened the door for tobacco control activities, and was created the first governmental body regarding tobacco control by headed of Prime Minister and Deputy. This committee was Minister of Health, but this committee only was active during of 2013. At that time, we government approved our drafted document strategy for tobacco control and also action plan. And also we prepared some changes to respond to obligations of Framework Convention on Tobacco Control. In the same year, I mean a whole packet of amendments in tobacco control law. But after 2014 the situation changed. We had a new Prime Minister, and the whole situation changed because of serious ties with tobacco industry. And it was very difficult to move forward, and it was a stagnation period for us, but we did not stop our efforts, and we activated our efforts since 2015. And after 2 years, we achieved our goal because we received, after new elections in 2016, we received new politicians who had more clear understanding of public health and also tobacco control. And head of healthcare committee became the prominent public health specialist. And he promised and he achieved, he became real champions of tobacco control. And afterwards, nevertheless of contradictions from governmental structures like Ministry of Economy or Business Ombudsman's Office, and also whole government, I can say, Parliament stayed very strong. We should take care for the public health and take care for the health of our population. And through this way, it was very hard, because second hearings is very important part to get final consensus from the members of parliament. And during of second hearing, government passed special, I would say, conclusions related to draft amendments. And on the final sentence, we have written that Georgian government does not, I would say, accept those kind of changes. What to do? It was, I would say, final effort done from the tobacco industry side, but members of parliament, as I mentioned, and another hand, NGOs, local organizations, also international organizations like WHO, UNDP, UNICEF, other international organizations and experts. We are one, I would say, group who wanted to achieve this, I would say, real goods for our public. And after 2 days of negotiations with members of parliament, Healthcare Committee chair together with their friends achieved and received agreement from the members of parliament. And 17th of May, it was historical day for us, 2017, Georgian parliament, I would say, made decision, and we are calling this decision and regulations as a new generation regulations, because we totally prohibited all types of tobacco advertisement, sponsorship and promotion, but it's not includes only tobacco products, also nicotine products, e-cigarettes, and heating tobacco products. First time through our law, we recognized heating tobacco product and electronic cigarettes as a tobacco-related products. And we regulated all products very similar to conventional cigarette. And one of the prohibition, total prohibition of tobacco advertisement, sponsorship and promotion was made for all tobacco and nicotine products. Also, we prohibited smoking in all public premises. There is very few exceptions. Also, government increased taxes at time and so on, and all efforts received very good support from the public. It was also huge support before the implementation of new changes, but afterwards it increased more. And also during of debates, tobacco industry created some disasters that after the prohibition of smoking in public premises, hospitality sector will bankrupt and most of facilities will be closed, and Georgia is a tourist country and what you are doing and so on. But when we learned the real situation and collected official data from Department of Statistics, it really justified that no negative results happened after prohibition of smoking in public premises. In opposite, healthcare, hospitality sector facilities increased, number of hospitality facilities since 2008 to 2019 increased, also increased their revenues, increased employees, number of employees, and turnover. Achievement, but after those kind of strong efforts, tobacco industry became more stronger, and they made decisions in their, I would say, headquarters to put more investment in unlawful marketing. Last time what we achieved is plain packaging regulation, which is entered into force since April 1st this year, and it's one of the great achievements currently at this stage. But before tobacco industry to the politicians postponed this regulation 4 times. Yeah, and it continues during the last 7 years. But finally we achieved our goal, and now we have plain packaging regulation effective in our country.
Thank you for joining us today. It's inspiring to hear about your courage and your persistence in the face of industry attacks, and I'm delighted at the progress that George is making, and I hope you and we learn from this conference.
Yeah. Thank you so much for your interest.
Well done, Georgia, and well done, George.
Thank you.
Many thanks.
Thank you.